TMJ Therapy of Utah specializes in temporomandibular disorders stemming from the temporomandibular joint. Now, some studies indicate that as many as 10 million Americans suffer from TMJ. Dr. Carl McMillan left a successful general dentistry practice to specialize in treatment of what is referred to as TMJ. He now has over 20 years of experience, 2 internships, a fellowship, and has treated nearly 3,000 patients from Utah and throughout the Intermountain West. Dr. McMillan discusses what TMJ is.
Ear pain, head and muscle pain, especially headaches behind the eye, where you can't eat smoothly, you can't open smoothly, all those are craniofacial pain syndrome. We commonly call TMJ. So it's been labeled TMJ, like laugh out loud, LOL. In texting, TMJ is what we call it, even though all that is temporomandibular joint. It's just the name of the joint. But when we say TMJ to each other, it means basically multiple types of symptoms, pain, and function of the jaw is disrupted.
Do you suffer from headaches or migraines, neck and shoulder pain, facial pain, numbness in your arms? Do you grind your teeth or have chipped teeth, jaw pain, clicking or popping in your jaw, ringing in your ears, or locking jaw? These are some of the symptoms commonly referred to as TMJ. Dr. McMillan goes on to talk about the process he uses to treat patients who may be suffering from this disorder.
We want all the symptoms, let the patient tell us everything, because then we can take those symptoms and put them in a list. Okay, what do we do in our therapy to basically decrease all the symptoms that they're having, or get rid of the symptoms? So that's number one. Number two, we go in a physical type of exam, basically how they open and close, how they function, where is it their pain with their headaches, do they have ear pain? A lot of patients don't think that ear pain and jaw pain are related. So we'll go over different pains and basically sit down and talk for a good 20-25 minutes to make sure that we have all the symptoms written down. And then we follow up with an x-ray to say, okay, everything that the patient's told me, what does it look like on that x-ray? Is it back up what the patient tells me? Sometimes the patient's been putting up with it so long that their pain level is high, and so a little pain to them is a big pain to me, because when I look at that x-ray, it's worse than they're telling me. So the x-ray tells me exactly what kind of therapy is needed to basically rehab that joint back to normal function.
One key difference with Dr. McMillan and TMJ Therapy of Utah is that every patient is treated based on their needs and their particular symptoms. Many TMJ specialists use a cookie-cutter approach to therapy, but Dr. McMillan believes that every individual case is unique and needs to be treated as such. In terms of general timeline, the goal is to relieve your pain on the first visit, but the complete therapy can take 12 to 14 weeks to completely tighten the joint muscles back to their normal function.
Basically, we're going to position the jaw in a place where the ligaments and tendons tighten up. So the boot on an ankle takes that ankle and puts it in a solid position so ligaments and tendons will tighten up. The jaw, what we want to do is use bite position retainers to position that jaw in the right place so that we get the ligaments and tendons to tighten up.
If you feel you are suffering from TMJ-related issues, schedule an appointment with Dr. McMillan at TMJ Therapy of Utah today. TMJ Therapy of Utah has locations all along the Wasatch Front and can usually get you scheduled very quickly. Dr. McMillan discusses why he specializes in treatment for TMJ rather than practicing general dentistry.
Well, there's not very many people see how wonderful a filling you put in their tooth. All they know is they're not in pain anymore. Whereas this, when you take away migraines and headaches and they can use their jaw, they can chew and eat again, is very satisfying, because now you're changing the quality of their life, not just the quality of their tooth. And so it's very satisfying.